Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist. And you're watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 849वां 849th एपिसोड है. Let's have the headlines for today. Now, we keep on speaking of many diseases, but anemia, खून की कमी, iron की कमी, ये अभी भी बहुत common है. And the union government has stated that Gujarat's anemia rate is much higher than that of the national average. Have nothing to be proud of anywhere in the country because it seems that 2/3 of all Indian women, 1/2 of all Indian children, and 1/3 of Indian men have anemia. Recent report reveals that the pharma industry has experienced increase in sale of antibiotics and paracetamol, and this is because of increased infections all over the country. Infections बढ़ती जा रही हैं, COVID भी वापस आ रहा है, तो अपना ख्याल रखें. Be careful, be vigilant. A Chinese scientist has claimed that COVID-19 virus may have originated from humans and not from animals, as was thought earlier. In the meanwhile, on other diseases, tuberculosis जो है, कई बार resistant होता है to drugs. So there are many drugs, there are many types of tuberculosis which are resistant to drugs. But now researchers have uncovered new treatment possibilities for them. तो जिन लोगों को MDR-TB है, multi-drug resistant tuberculosis है, उनके लिए hope है, आशा की किरण है. And researchers, speaking about autism, हाल ही में पिछले हफ्ते World Autism Day था, they have found evidence of 4 different types of autism based upon brain connectivity and individual behavior. इस पे भी कभी हम चर्चा करेंगे, मगर आज का टॉपिक देखते हैं क्या है. We are going international today. And why we are going international is because diabetes occurs across the world. पूरी दुनिया में शुगर का बोलबाला है, unfortunately so. मगर हम उससे लड़ सकते हैं. We can fight diabetes. We can fight it with insulin. However, insulin जो हमारी सहेली है, हमारी दोस्त है, हमारी friend है, उसी को कई बार हम negative way में देखते हैं. And people living with diabetes are same across the world. So let's have experiences from our guest who has joined in from Nepal today. Warm welcome, Ms. Kushal Priya Sharma ji. Warm welcome, madam.
Thank you, doctor. Thank you so much.
Thank you. Thank you, Kushal ji, and thank you for being with us. People from India and Nepal watching you. Good evening from Swapna Jain ji. Madam, Swapna is from Vellore in Tamil Nadu, South India. Very strong and passionate advocate for patient health, for patient awareness. We also have with us Anita Dallani ji, Ganesh Ambore ji, and Vinay Gupta sahab. सब आपको good evening कर रहे हैं, Kushal ji.
Good evening.
Allow me to introduce Madam. Madam Kushal Priya Sharma is an enthusiastic pharmacist working at Loop in Nepal. She is the youngest and perhaps the only diabetes educator in the country. She firmly believes in patient-centered care, in person-centered care. And she is a passionate advocate for educating people, for empowering people. So empowerment through education in diabetes. And she has been providing excellent care and support to people living with diabetes. Or dedicated है madam towards helping people live healthy and happy and active lives. So madam, warm welcome to the show.
Thank you, doctor. Thank you so much for giving me this wonderful opportunity.
We are very happy to have you with us. Sayyid Hafiz Sahib has also joined. And the question is, our topic is patients' reactions towards insulin pens. So could you first tell us about diabetes? What is diabetes? How common is it in Nepal, in your country?
Diabetes is a metabolic disorder which is caused by the metabolic problem in carbohydrate, protein, fat, in which the blood sugar level of the body is elevated. And in context of Nepal, I has researched that it's been increasing day by day, and since 1990 to 2019 मा चाहिँ diabetes is increased by 62% in the people. And now people living with diabetes are total around 1.4 million. In exact 1,412,180 people who are living with diabetes in Nepal. And
So-
among them, the male are the more susceptible for the diabetes.
More affected. And so diabetes is increasing in Nepal और इंडिया में भी diabetes बढ़ती जा रही है. And जैसे कि मैडम ने कहा, diabetes का जो percentage है वो बहुत तेजी से बढ़ रहा है. It's rising so fast that we are not able to keep pace with it. Dr. Ramesh Pal Singh Pawar sir has also joined. Sir is a 72-year young pediatrician from Saharanpur in Uttar Pradesh, and Vinayak Sharma ji has joined also. Dr. Ramesh Pal Singh Pawar sir says that earlier we very rarely used to see diabetes in children, but now it is so common. So is that true in Nepal as well?
Yes, it is, but I have encountered a few patients of diabetes, type 1 diabetes. In my whole experience, I found only 5 to 6 patients of type 1 diabetes, but all the cases are of type 2 diabetes now.
Type 2. Okay. And type 2 is more prevalent in India as well. Maybe 95-90% of all patients have type 2 only. And type 1 diabetes, the diagnosis is increasing now, maybe because testing is more frequent. And now pediatricians also, they are more, sensitized. Like किसी को fever है, तबीयत नहीं ठीक, bathroom में जलन है, बच्चा पतला हो रहा है. So instead of thinking of tuberculosis first, now people think of diabetes first. So diabetes is common Nepal, maybe India, maybe Baki countries, maybe. Uh, does everybody with the diabetes, with type 2 diabetes, need insulin, Madam Sharma?
I don't think so. Everybody with type 2 diabetes need insulin. In the early phase, if they detect that they have the diabetes, they can go with oral anti-diabetic drugs in the early phase, in the pre-diabetic condition. But in context of Nepal, people used to went to hospital for the treatment only after they become serious, or they
Yeah.
don't come earlier for the regular body checkup, or mm, always they come late. That's why they used to they have to use insulin.
ये बात सही है, ये इंडिया के लिए भी सही है व्हाट मैडम इज सेइंग. नाउ टाइप 2 डायबिटीज में द फर्स्ट लाइन ट्रीटमेंट इज लाइफस्टाइल मॉडिफिकेशन एंड मेटफॉर्मिन. बट फर्स्ट लाइन मींस कि आप फर्स्ट डे पे आ भी जाएं डॉक्टर के पास, यू कम टू शो द डॉक्टर, देन डाइट एक्सरसाइज टैबलेट्स विल हेल्प. बट अगर आप लेट आते हैं एंड कुशल जी यूज द वर्ड सीरियस, तो अगर पेशेंट सीरियस है, सिक है, सिम्टोमेटिक है, आपको तकलीफ है, सिम्टम्स हैं, राइट, या सिवियर हाइपरग्लाइसीमिया है, वेरी हाई लेवल्स ऑफ ग्लूकोज, या यू आर इन अ स्पेशल सिचुएशन जैसे कि प्रेगनेंसी, फीडिंग द बेबी, मे बी किडनी डिजीज, लिवर डिजीज, हार्ट डिजीज, या सर्जरी, यू आर वेटिंग फॉर सर्जरी और शुगर कंट्रोल नहीं हो रही. तो देखो इतने सारे ऐसे हो गए: सीरियस, सिक, सिम्टोमेटिक, सिवियरली हाइपरग्लाइसेमिक, स्पेशल सिचुएशन एंड सर्जरी. इन सब में इंसुलिन लेना ही पड़ेगा बिकॉज पेशेंट्स कम टू लेट. अगर जल्दी आ जाएं तो देन इट मे बी पॉसिबल टू कंट्रोल विद टैबलेट्स, बट वो फिर अगर जल्दी आ जाए मींस कि जल्दी आना पड़ेगा. Vinay Gupta ji says that in the last 10 years, what has changed is that patients with diabetes have increased significantly. And these numbers that you have said, Madam Kushal, do you see that in the clinics as well? जैसे जब आप काठमांडू में जाते हैं या बाहर जाते हैं to the various hospitals, do you see that the number of people with diabetes is more in the hospitals?
Yes, to be honest, I don't have that much exposure in the hospital before this year, or before 2020, 2022 and 2023. But since now the number of people with the diabetes are increasing day by day, and some of the physicians and endocrinologists used to say that the number of people with the diabetes uh, are increasing after COVID in a rapid number.
Yeah, that is true in
Uh,
India also. And Kushal ji, warm greetings for you from Pakistan. Inam ji has logged in, and Inam ji ko kahenge Ramzan Kareem, and also we hope that you have had your iftar for today. That we hope that you have been able to break your fast today. So warm greetings to you, of course, from India, from Nepal, and also from Pakistan, Kushal ji. So
thank you so much.
डायबिटीज सारी कंट्रीज में बढ़ रहा है और बढ़ता जा रहा है. विनय गुप्ता जी कहते हैं दैट सो कुशल जी, इज दिस ट्रू और नॉट? सिंस नेपाल इज अ हिली कंट्री, अ माउंटेनियस कंट्री, people have to walk more, they exercise more, so maybe there is less diabetes in the mountains and hills as compared to in the plains in the Terai region of Nepal. Any comments on that?
I think in comparison with the Tarai regions, hilly and Himalayan regions, the exposure of the people with the hospitals also is less in amount. They used to busy with their own lifestyle, and they only visit hospital when they become serious or they become sick only. And
Hmm.
be, if their sugar level is increasing day by day, then also they not come to so in the hospital. That's why this might be true for the people who are doing exercise, but nowadays people are only technology oriented and the service oriented. That's why people uh, are leaving their hometown or the home country, leaving their works and shifting towards the city area in the Kathmandu, not working or not doing their lifestyle modification. The people who are living in the hilly and Himalayan, they might be
They
not
might have less
facing.
time,
Uh,
and also they might not be showing the doctor.
yes.
We have with us Dr. Anshul. Dr. Anshul is a diabetologist in Chhattisgarh region, and he says that Chhattisgarh and Nepal have a lot in common. So there are big cities also, like Raipur in Chhattisgarh and Kathmandu in Nepal, and then there are rural areas as well, where people are not able to show the doctor or they don't want to show the doctor. So,
Hmm.
question from him is, Kushal ji, you work across entire Nepal now. Is that correct?
No, in actual, I work only in the Kathmandu Valley, but the people of whole country come for the treatment in the Kathmandu. That's why my exposure is for
For
throughout
entire
the
Nepal.
Nepal.
So with this, so we've spoken about diabetes now, and we are speaking of insulin. So when you advise insulin, and the topic we have chosen is pens. So either we can give insulin as vial and syringe, or as pen. So what are the advantages of pens?
It's feasible also the patient, and they don't need refrigerator when they use to travel, and the use of the syringe is syringe and the vial that may cause confusion, that may create confusion to the patient to use the
Hmm.
unit as well. So uh, I will suggest patient to use pen rather than the insulin syringe.
पेन वाकई यूज करना आसान है और कंफ्यूजन कम होता है। पेन सिखाना, टीच करना भी आसान है और पेन
Hmm.
सीखना, समझना भी आसान है। सो इट इज ईजियर फॉर द टीचर, द एजुकेटर, आल्सो फॉर द पेशेंट। एंड कई लोग बोलते हैं कि कॉस्ट की दिक्कत आती है। सो हाउ डू यू कवर दैट, कुशल जी, इन योर प्रैक्टिस? Like, do you have durable pens where we can reuse and reduce the cost?
Yes, we have, but the patient who are not able to afford the cost of the pen, we used to they give them free on cost for the patients only on the
Right.
doctor's recommendation.
So,
That's how we are managing this.
तो जब आपको पेन मिल जाता है फ्री, या मान लो खरीद भी लिया, इट इज अ ड्यूरेबल और रीयूजेबल पेन, उसके बीच में
It's a
कार्ट्रिज डलना चाहिए। हाँ,
yes, it's a reusable one.
reusable or durable, so you can
Yes.
use again and again. You have disposable pens also and you have durable. तो ज्यादातर
Mm.
ड्यूरेबल पेन चलते हैं क्योंकि लंबी देर चलेंगे, एंड उसमें रिफिल या कार्ट्रिज डल सकती है। तो बिल्कुल ऐसे ही है जैसे आपने पेन खरीदा और उसमें आप रिफिल डाल रहे हैं, तो 2 रुपए का सिक्का आ जाएगा, 2 रुपीज रिफिल यू विल गेट। ऑफ कोर्स इंसुलिन विल कॉस्ट मोर देन 2 रुपीज, बट इट्स क्वाइट इकोनॉमिकल। Anshu Singh ji also joining the discussion and asking. So, Kushal ji, now you have spoken, you have taught patients from across Nepal. What are the common uh, reactions that you see when you speak with them about insulin? Are
When
they
I
happy?
speak
Are they angry?
with the doctors prescribe insulin
Yes.
for the patient at first, they used to say, "Sweet, नहीं 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 म लगाउँदिन." Like their reaction is like that in the first, in the starting, and whenever I saw them needle or the needle size of that, then 50% of the patient counsel themselves with that only by seeing the needle size, and that prick phobia is the must
Main.
one, and yes, and
What? Carry on, madam.
no no you can.
So what madam is saying is right. Sui, and across India, people will say sui. अब सोचने की बात है, what is the picture in your mind of a sui? If you are a seamstress, let us say you are a tailor, तो आपको इतनी सी सुई सूझती है. You will think it is maybe 1.5 centimeter long. If you are a surgeon, then you will think of sui in a different way because आप operation theater में use कर रहे हैं. अब supposing you happen to be a shoemaker, तो फिर आपके पास भी सुई धागा है, तो you will think of your suis. So पेशेंट सेज सुई, बट अंटिल यू शो हर और शो हिम कि सिर्फ 5 मिलीमीटर की नीडल है, बहुत पतली है, दिखाई भी नहीं देती। अब जैसे माई स्पेक्स हैव चेंज, तो आई हैव टू रिमूव माई स्पेक्टिकल्स टू सी द नीडल ऑल्सो। सो देन पेशेंट बिकम्स लेस अफ्रेड। सो लेट अस टॉक ऑफ डिफरेंट टाइप्स ऑफ पेशेंट्स, एंड हमने ए फॉर अफ्रेड यूज कर लिया। तो मैडम को पूछते हैं, नाउ वी हैव डिफरेंट टाइप्स ऑफ पेशेंट्स कमिंग इन, लेट अस जस्ट एक्सप्लेन इन सिंपल इंग्लिश। योर पेशेंट मे बी अफ्रेड और एंशियस, दैट इज वन। एंड कुशल जी, अस्सलाम फॉर यू फ्रॉम काबुल एज वेल, फ्रॉम अफगानिस्तान। तो इनाम जी को तो रमजान करीम कहा ही था, दानिश साहब को, डॉक्टर नूर आगा दानिश इज ग्रीटिंग यू फ्रॉम काबुल, फ्रॉम अफगानिस्तान। सो एंटायर साउथ एशिया वाचिंग। एंड दानिश साहब, सलाम आपको भी, एंड रमजान करीम, एंड वी होप यू हैड अ फुलफिलिंग फास्ट टुडे, और आपने रोजा तोड़ लिया है। सो सम पेशेंट्स में बी अफ्रेड और एंशियस व्हेन यू टॉक अबाउट
Yes.
इंसुलिन,
And
others may get angry.
And yes, when sometimes I used to say the patient that you have to use insulin from now on. Then the patient used to say that my sister also have diabetes. She has a blood sugar level of 400 something, and she is eating whatever she want to eat, and she is not using insulin as well. And you are doing injustice with me. You are forcing me to use insulin. The people used to react with this.
That way also. So that is avowed denial. So you want to go into denial, and some people will be angry or argumentative, like Kushal ji is saying. They will begin arguing. So some are
Yes.
anxious or afraid, others are angry or argumentative, and yet others may be just apathic, like they are not bothered. So they may say, कि पिछले जन्म का फल है, मुझे शुगर हो गई, अब मुझे तो शुगर का जो दुख है वो भुगतना ही है, so nothing can happen, I am going to die, I don't want to take insulin. So different types are there. So how do you handle, Kushal ji? So जैसे अब यही patient आ गई जो कहती है कि my sister is taking fried YY noodles 3 times a day, and you are
Yes.
telling me to eat only cucumber and and Nepali saag. So how will you handle such a patient?
I counsel her for that आप आपको ये नहीं खाना है और आपके बहन को भी ये कहना है कि आपको ये नहीं करना है, ये अच्छे नहीं है आपके स्वास्थ्य के लिए। आपकी शुगर लेवल इतनी बड़ी है, अगर आपने शुगर लेवल कंट्रोल नहीं किया तो आपका शुगर इतनी बढ़ जाएगी कि आपके होल बॉडी को, आपकी आंखें, आपकी किडनी, आपकी ब्लड
Heart.
प्रेशर, आपके हार्ट पे प्रॉब्लम आ जाएगी। It will take some time, but gradually they convince.
So we tell them you have to give positive and negative feedback both. तो ज्यादातर
Yes.
पॉजिटिव फीडबैक के साथ शुरू करते हैं कि आप टीका लेके देखें, आप बहुत अच्छा महसूस करेंगे, तंदुरुस्त महसूस करेंगे, यू विल फील गुड, यू विल फील हेल्दी। आपकी जो भी कंप्लेंट्स हैं, मे बी यू हैव पेन इन द शोल्डर, यू आर नॉट एबल टू मूव योर जॉइंट्स, यू आर नॉट एबल टू रन फास्ट, ये सब ठीक हो जाएगा। सो दैट इज पॉजिटिव मोटिवेशन, यू विल अचीव द फॉलोइंग। कभी कभी नेगेटिव मोटिवेशन भी देना पड़ता है कि यदि आप टीका नहीं लेंगे, अगर आपने टीका ना लिया तो ये गड़बड़ हो सकती है। सो बोथ आर रिक्वायर्ड टुगेदर, बट वी ट्राई टू डू पॉजिटिव। जो
Positive.
जब उन्होंने कहा कि मेरी दीदी या मेरी आपा गड़बड़ कर रही हैं खाने में, तो फिर आंसर ये है, आप दीदी को भी ले आए, उनको भी मैं समझाऊंगी। सो दैट इज व्हाट कुशल जी सेज, उनको भी साथ। And so Kushal ji, today we Dr. Danish from Afghanistan, Inam ji from Pakistan, and Sumit Roy ji has joined in from Nepal. So Sumit is saying high five to you.
Hello, Sumit sir.
So high five, and India से of course सरताज सिंह जी हैं, विनय गुप्ता जी हैं। विनय गुप्ता जी कहते हैं कि insulin comes in so many forms. We have short acting, we have long acting, and also mixed, pre-mixed. So long acting is actually preferred because you will need only one injection per day. So in your practice, how frequently do you use one injection per day? And how frequently do your doctors prescribe 2 injections or 3 or 4 injections per day?
If the patient are admitted in the hospital and their sugar level is elevated highly, and they have to control their and them at the hospital, then they used to use regular insulin. And if the patient who are having high elevated blood sugar after the postprandial, after the food, then they used to use mixed insulin. And if the patient fasting is high, then the doctor used to prescribe glargine. According to my study, that uh,
So,
according to
yeah,
getting patients from them.
yeah. So what Vinay Gupta ji is saying is right. अगर fasting glucose high है तो glargine use करेंगे, which is once a day. Uh, मगर अगर पेशेंट दाखिल हो अस्पताल में तो यूजुअली 4 इंजेक्शंस देने पड़ते हैं, 1 ग्लार्जिन एंड 3 रेगुलर इंसुलिन फॉर द मील्स. एंड ऑफ कोर्स फॉर कन्वीनियंस ओपीडी में समटाइम्स वी गिव प्री मिक्स्ड, दैट इज ट्वाइस अ डे, जिसमें फास्टिंग एंड पोस्टप्रेंडियल दोनों ही कंट्रोल हो जाता है. So we have talked of diabetes, we've talked of insulin, and we've talked of different emotions that we get. Angry patients, argumentative patients, प्यार से मनाना पड़ता है. We also have sometimes anxious people who are afraid, तो उनको needle दिखा दोगे, डरो मत. ये इसमें कोई डर वाली बात नहीं है. It will help you. मैंने अपनी ओपीडी में देखा है, what I've seen is कि if I keep patients for 2 or 3 minutes, which is quite difficult actually. Sometimes busy OPD hoti hai, so many things going on together, and sometimes you yourself have become impatient. But अगर आप 2-3 मिनट patience रखें and you continue the conversation with the patient को जाने ना दें, आप engage करते रहें, दीदी कोई बात नहीं, बाबूजी कोई बात नहीं, ये देखो ऐसे समझाते हैं, this is the advantage. Usually people agree. And Kushalji, blessings for you from Dr. N.S. Sharda. Sir is very senior physician from Ahmedabad in Gujarat state. So he is sending you his blessings and wishing you all the best for your career.
Thank you so much, sir. Thank you so much.
And Sharda sir, we are really happy to have Kushal with us. जब हम कुशल को देखते हैं, when we see such bright faces, तो ऐसा लगता है कि जो फ्यूचर है साउथ एशियन डायबिटीज का, साउथ एशियन हेल्थ का, दैट इज इन सिक्योर हैंड्स. तो बहुत आई एम श्योर डॉक्टर शारदा सर एंड एवरीबॉडी एल्स विल एग्री विद मी. कुशल को देख के हमें लगता है कि हम मतलब अच्छी जगह जाएंगे. सो आवर हेल्थ विल बी टेकन केयर ऑफ. So we've talked of different reactions of patients. How do we explain the insulin technique? Is it difficult? क्या मुश्किल होता है इंसुलिन लगाना, या is it easy?
Uh, it is easy for us that we are familiar with them, and it patient used to think it's difficult at first, but when I talk with them and ask them to put insulin yourself, I will I will give you guidance and you have to do it on your own self. After taking one dose by the patient, they used to say that it's easy, then now I can do it on my own self.
So it's just that single experience जो चाहिए, just once. And certainly
Hmm.
Bimla Kapoor ने भी log in किया है. Certainly taking insulin is easier than maybe cooking food or riding a bicycle or going to work every day. तो फिर हम पेशेंट को बोलते हैं, दीदी जब आप खाना बना सकते हैं, इतना टेस्टी टेस्टी खाना बनाते हैं, तो वो मुश्किल है, गेटिंग ऑल द मसालाज एंड द रेसिपी करेक्ट. तो जब आप वो चीज कर सकते हैं तो फिर आप टीका भी लगा सकते हैं. Gupta ji, thank you, sir, for your kind words, and he is appreciating Kushal ji as well for your very articulate answers. So, thank you.
Thank
तो अब patients लेते हैं, real patients, madam. In the last maybe 1 or 2 weeks, any difficult patient that you faced, जहाँ पे आपको बहुत मुश्किल आई in explaining insulin या in counseling about insulin, and how did you tackle the patient?
that I got the day it it might be around 5 days ago. I got one patient who have to use glargine insulin, and she used to say that I'm in my last stage of my life. Uh, when my father used insulin, he died in about 3 to 4 months, and then now I'm also in the last stage of my life, and you are making me to use insulin. That's making me to use insulin. There is I am in the last stage of my life. She was talking with me like that, and I'm going to die as soon.
Mm. So, how did you handle her? How did
I
you tackle
told
her? How did you make her happy?
I told her that in your father's time, you come late to the hospital. That when the patient was serious and he was suffering from kidney problem as well, heart disease as well, and he has done the eye operation twice, but until that time he refuses to use insulin. That's why he was not using insulin, and his blood sugar level was also high. But you are here at the time, at the proper time, at right time, and that won't be problem for you. You won't be die. You will be living uh, a- and living for a long years. Then don't be afraid of the death. You will live, and your blood sugar will get control, you will be healthy. So
तो जब
like
ऐसे पेशेंट आता है, हाँ, द फर्स्ट थिंग इज टू एक्नॉलेज, हाँ जी दीदी, आई अंडरस्टैंड योर कंसर्न, आपका कंसर्न जेन्युइन है, जायज है, सो आई अंडरस्टैंड दैट यू आर कंसर्न्ड. सो फर्स्ट इज एक्नॉलेज, देन यू डाइसेक्ट, यू एक्सप्लेन. देखो, जो आप सोच रहे हैं वो 20 साल पुरानी बात है. तब हॉस्पिटल्स भी अलग थे, डॉक्टर्स को भी समझ नहीं थी, एंड पापा में भी लेट आए हों, मम्मी लेट आए हों इलाज कराने, बट मे बी डॉक्टर्स को भी समझ नहीं थी, वो टाइम पे बता नहीं पाए how to take insulin. Maybe the doctor was not there, not able to explain 20 years ago. And certainly there was no diabetes educator in Nepal that time. That we are 100% sure. ये भी कहना है कि उस टाइम पे इंसुलिन की क्वालिटी, इंसुलिन के पेन्स की क्वालिटी एंड ग्लूकोमीटर्स की क्वालिटी अच्छी नहीं थी. इट इज अ वेरी यंग सब्जेक्ट, बट नाउ वी हैव गॉट गुड क्वालिटी इंसुलिन, गुड क्वालिटी पेन्स, एंड वी कैन चेक योर ग्लूकोज रेगुलरली. तो आपको चिंता करने की जरूरत नहीं. So first you acknowledge, then you dissect, you explain the problem that the patient is worried about. कि पहले ऐसा ऐसा था, एंड फिर फ्यूचर में, जैसे कुशल जी ने कहा, सो ऑप्टिमिज्म, अब आप आ गए हो, टाइम पे आए हो, एंड वील मूव टुगेदर, इकट्ठे मिलके इलाज करते हैं शुगर का. एंड देखो, पीपल कैन क्लाइम माउंट एवरेस्ट आल्सो इवन इफ दे हैव टाइप 1 डायबिटीज. इंसुलिन साथ लेके जाते हैं ऊपर, तो सर्टेनली वी कैन मैनेज लाइफ. तो डॉक्टर शारदा सर भी कह रहे हैं दैट वी कैन कन्विंस द पेशेंट, एंड इफ वी हैव गुड कम्युनिकेशन स्किल्स, तो एंड सरताज जी कह रहे हैं आप स्वीटली बोलोगे तो फिर तो सब मान ही जाएंगे. और लोग डरते भी हैं कि स्वीट्स खाने से शुगर हो जाती है. तो पॉइंट वेल टेकन सरताज जी. तो क्वेश्चन ये आ रहा है कि एक तो इंसुलिन के लिए मनाना है. इन योर वर्क डू यू आल्सो हैव टू स्पीक अबाउट डाइट एंड एक्सरसाइज टू योर पेशेंट्स?
yes, I have to, but if people are suffering from diabetes, they they usually concern about their diet as well, their exercise as well. Most of the people, and they used to ask about what foods we have to eat. अब हमें भात नहीं खाने को मिलता है क्या? And
तो
most
क्या
of the
जवाब देती है
people,
बात का? Dal bhat is, for those who are not from Nepal or from North India, dal bhat is rice and dal. So
right?
dal bhat खा सकते हैं क्या शुगर में? How do you tackle this?
I asked them to eat rice once a day in the morning. Not in Nepal, there is not diet chart is in Nepal. The timing of the lunch and dinner is around 10 in the 10 in the evening, 7 8. Not it is like that in the India. That in the India people used to take lunch at 1 to 2 p.m. Is
Hmm.
I am right? Then
Yeah.
uh, what I am talking about the peoples of
You
diet.
mean,
And
yeah.
yes, I asked them to eat rice once in a day in the morning, brown rice or the pre-boiled rice, and in the evening quit the rice and you eat whatever other things you want to eat, like bread, like roti,
Hmm.
chakla. I don't know what to say to that in English or in Hindi, but roti, chakla, the and jau ko satu. I asked
Yes.
them to change their diet. Then.
So we can actually talk about diet, and we welcome अनामिका अनु जी भी आपको गुड इवनिंग कर रही हैं, विपिन शर्मा जी भी नमस्ते कर रहे हैं. तो स्वीट्स तो कम करनी है, बट जब डाइट की बात करते हैं तो भी इंस्टेड ऑफ हैविंग अ ब्लैंकेट जीरो ऑन राइस और चावल और भात, यू कैन टेल देम कि आप थोड़ा सा खा लें, एटलीस्ट वंस अ डे खा लें. एंड यू कैन ऑल्सो टॉक अबाउट मील सीक्वेंसिंग. सो मील सीक्वेंसिंग इट मीन्स फर्स्ट फाइबर एंड फ्लूइड. पहले पानी पी लें या लस्सी पी लें, बटर मिल्क, along with salad. So you fill your stomach with fluid and salad. First fluid and fiber. उसके बाद protein. Whatever the patient is taking, it might be meat, it might be eggs, it can be vegetables also. You begin eating that, and then after that you start eating the rice. तो meal sequencing is important. फिर चावल कैसे बनाते हैं, जैसे मैडम ने कहा, पार बॉइल्ड या प्री बॉइल्ड राइस ले लें, एंड यू कैन टेक बॉइल्ड राइस, डोंट टेक फ्राइड राइस. ऐसे ही नूडल्स भी, बॉइल्ड नूडल्स विल बी ओके, बट फ्राइड नूडल्स विल नॉट बी ओके. एंड जब आप राइस बनाते हैं, यू कैन टेल द पेशेंट ऑल्सो कि थोड़ा सा बीच में वेजिटेबल डाल दें या बीन्स डाल दें, या दाल डाल दें, चने या दाल, so it becomes a mixture and the glycemic index comes down. This way patients are very happy because you have not told them to leave their bhat, otherwise they will feel so, you know, lonely and so inadequate. साथ में you are teaching them new recipes also of how to make the bhat. So keep on learning
Mhm.
new recipes and teaching them. एक और चीज है जो जो मेरा फेवरेट फूड है नेपाल का. आई हैव टू फेवरेट फूड्स. वन इज द नेपाली साग, which I love. That is wonderful for people with diabetes also. So Nepali saag you can take as a salad, you can take as a full meal, and you can take along with the bhat. So first you begin eating the saag, and after that you begin eating the rice. And एक और है जिसको हम हिंदी में बोलते हैं कट्टू का आटा, बट अब मेरे को नेपलीज याद नहीं है. इट इज द ब्राउन कलर्ड डो एंड यू ईट इट ऑन द एकादशी वाला व्रत.
एकादशी वाला कट्टू का आटा.
Yeah, brown colored, and maybe somebody else, Sumit is watching, and he can help me, or maybe Mukesh ji can help me. It is my favorite food. So when I go to the Nepalese restaurant, to the Thakali restaurant, I know what to order, and they also give it to me. We'll find out the name in the next
I
15 minutes.
I guess you are saying
Dodo,
about Dido.
डिडो डिडो, यस. देखा, डोडो तक तो मैं पहुंच ही गया था. देखा मेरी मेमोरी कुशल. मेमोरी के तौर पे बताता हूँ कि हमने एक ब्रह्मी का पौधा लगाया अपने घर में. सो वी हैव अ ब्रह्मी प्लांट, एंड रोज मैं उसके 2 पत्ते खाता हूँ, एंड माय मेमोरी इज कमिंग बैक नाउ. And the Brahmi ka pauda also, that also comes from Uttarakhand or Nepal. So if you want the genuine Brahmi plant, it has to come from Nepal only.
Its Brahmi means tulsi plant or something
Different.
else.
Different. Tulsi is
Mm,
basil, and Brahmi, I don't know the English. So
okay.
Tulsi is a holy plant, and you take it as a spice also. Brahmi is for memory. So only if you're on the
Okay.
wrong side of 50, then you need it. But Dido tak pahunch gaye. So Dido, and for those who are watching from Nepal, the word will be Dido. And from those who are watching from India, the word will be Kuttu ka आटा. इसमें भी ग्लाइसेमिक इंडेक्स जो है वो बहुत लो है. The glycemic index is low, and the satiety level is high. So you eat a little bit of Dido and your stomach gets full. But you have to eat a lot of rice for your stomach to get full. So Dido also you can encourage. But Kushal ji, अगर आप Dido को promote करेंगे, let us say in the villages of Nepal, what will be the patient's reaction? And if you promote it in high-end Kathmandu society, then what will they say to you?
Like
If you promote
nowadays,
Dido to rich people in Kathmandu.
yes, people, but nowadays people are concerned about their health as well. The people who are who have normal blood sugar, or who are are the people who are normal. They used to eat chakla, the atta ko bhat, or
Yes,
chakla, the rice of corns,
yes.
and Dhiru, the people, the in the there most of the place of the Kathmandu, the restaurant are also promoting the Nepali food, Dhiru.
Yeah.
And some people react that they used to say that मेरो मुटु पोल्छ after having Dhiru or chakla. The people react with that.
So what does that mean when they say after Mera
And
in
they say
English?
that ha, they feel discomfort at the
Stomach
heart.
gets full.
Yes,
Yes.
or
हाँ.
the upper
तो
part of the stomach.
So what we tell them is कि थोड़ा थोड़ा खा लो. Don't eat one plate. You eat half a plate. And actually, it is like a treatment for diabetes. And सुमित रॉय जी को भी थैंक यू करेंगे. सुमित सर ने भी ढीरो बता दिया. थैंक यू फॉर टेकिंग केयर ऑफ अस. तो अब देखो, डायबिटीज में हाउ टू कन्वर्ट नेगेटिव इनटू पॉजिटिव. अब पेशेंट ने आके हमने कहा कि जी आप ढीरो ले लो बिकॉज इट इज अ लोकल फूड, इट इज अ नेपलीज फूड, एंड वी हैव बीन ईटिंग इट फॉर सेंचुरीज, एंड ऑल्सो द ग्लाइसेमिक इंडेक्स इज लो, सैटिस्फैक्टरी लेवल इज हाई. तो क्वालिटी भी ठीक रहेगी और कैलोरीज भी कम हो जाएंगी. पेशेंट आके कहता है जी मेरा तो पेट भर गया एंड आई हैव डिस्कम्फर्ट. तो वन वे ऑफ आंसरिंग इज कि आप बिल्कुल मत खाओ. बट अनदर वे ऑफ आंसरिंग इज दिस कि सर दिस इज एक्चुअली हेल्पफुल फॉर यू. इट इज रिड्यूसिंग योर एपेटाइट. ओवरऑल योर ग्लूकोज विल कम डाउन एंड इवन द डोज ऑफ इंसुलिन विल कम डाउन. सेकेंडली, डायबिटीज का लक्षण होता है, इट इज अ सिम्टम ऑफ डायबिटीज कि आपको भूख बहुत लगती है. When we correct diabetes, the symptom will get corrected. इसलिए आपकी भूख खत्म हो गई ढीडो खा के. सो ढीडो इज हेल्पिंग यू इन डायबिटीज केयर. तो 2-4 दिन की बात है. यू विल गेट यूज टू इट. प्लीज डोंट स्टॉप द ढीडो. मे बी यू रिड्यूस द डोज, एंड you will note that in around 20 days or so your insulin dose will also come down. तो इस तरह से you can create a positive feeling around it. सरताज जी एक is sharing a best practice कि चावल का पानी निकालकर खा सकते हैं, एंड दैट इज करेक्ट. अब जो चावल का पानी निकलता है, दैट शुड आल्सो नॉट बी थ्रोन अवे बिकॉज इट हैज गॉट लॉट ऑफ न्यूट्रिएंट्स इन इट. सो इन इंडिया व्हाट वी मे टेल द लेडीज के जो आपने चावल का पानी निकाला है, जब आप आटा गूंद रहे हैं, व्हेन यू आर नीडिंग द डो फॉर द नेक्स्ट मील, उसमें आप वो पानी डाल दें. सो यू कैन यूज दैट वाटर while preparing the flour for the next meal's chapatis. Supposing you don't want to make chapati, you can put that water in whatever dal or vegetable you are cooking. तो दाल के बीच में पानी तो डालना ही था, so don't throw the water away. You just put it in the pressure cooker when you are cooking the dal. And thank you सरताज जी for sharing this. जब हम ये चीजें शेयर करते हैं, तो अब जब आप डायबिटीज का इलाज कर रहे हैं, यू थिंक ऑफ मिलियन थिंग्स, लाइक कुशल जी विल थिंक ऑफ द ग्लार्जिन पेन, द डोज, द टेक्निक. बट व्हेन यू स्पीक ऑफ दीज कुकिंग वाली थिंग्स ना, देन द पेशेंट फील्स कि हाँ, ये जो लेडी है, कुशल प्रिया मैडम है, शी इज थिंकिंग ऑफ मी एज अ ह्यूमन बीइंग. इसको पता है कि मैं किचन में क्या काम कर रही हूँ फॉर माई सेल्फ, फॉर माई हस्बैंड. फैमिली में तो कोई थैंक यू करता नहीं है, बट देखो एक कुशल जी तो है, मेरे को थैंक यू कर रही है फॉर टेकिंग केयर ऑफ द फैमिली. सो वी शुड टॉक अबाउट कुकिंग ऑल्सो, आई थिंक, विद पेशेंट्स एंड दे लाइक. अंशु सिंह जी एक और बेस्ट प्रैक्टिस शेयर कर रही हैं, दैट इज दैट चावल का पानी, व्हेन यू टेक द वाटर आउट, चावल का पानी इज यूजफुल फॉर स्मॉल चिल्ड्रन, सो फॉर ग्रोइंग अप, सो यू कैन गिव इट टू द चिल्ड्रन एज वेल. थोड़ा सा नमक मिर्च डाल के, एंड यू कैन पुट लोकल नेपाली स्पाइसेस, एंड यू कैन ड्रिंक इट जस्ट लाइक दैट एज वेल. दैट इज ऑल्सो राइट. You might want to add a little bit of lassi or buttermilk or milk to it if you want. विपिन शर्मा जी क्वेश्चन पूछते हैं जो मैं लेता हूँ. ब्रह्मी इज अ ट्रैंक्विलाइजर. या ब्रह्मी इज गुड फॉर द ब्रेन एक्चुअली. तो मैं तो मॉर्निंग में लेता हूँ 2 पत्ते. इट्स सपोज टू हेल्प इन इन इम्प्रूविंग मेमोरी, एंड एज अ ट्रैंक्विलाइजर ऑल्सो आई थिंक इट विल काम द ब्रेन, सो इट्स अ गुड थिंग टू हैव. विपिन शर्मा जी ये भी पॉइंट करते हैं दैट द ग्लाइसेमिक इंडेक्स ऑफ वेरियस राइसेस इज डिफरेंट. तो नेपाल में जैसे ब्राउन राइस है, और हम अगर करनाल में हम चावल खरीदेंगे, वी विल से पक्का चावल, और हिमाचली चावल और पहाड़ी चावल, इट इज द सेम थिंग. द सेम पहाड़ी चावल इज कमिंग फ्रॉम हिमाचल प्रदेश एंड फ्रॉम नेपाल. उसका ग्लाइसेमिक इंडेक्स लो है, एंड द सटाइटी इज मोर. So, Kushal ji, do your patients ask you also, how do I cook rice or how do I cook vegetables? Does that question come in the discussion or it doesn't come?
Not till now, the patient haven't asked me about how to cook rice or how to cook vegetables, but they asked me what to eat or what kind of rice. If I wash rice properly, then is it okay to have rice in the evening as well? They used to ask me like this.
And we can begin speaking about cooking as well, because it creates a very good bond. And even if you don't know cooking yourself, जैसे मुझे भी cooking नहीं आती, तो even if you don't know cooking yourself, you speak with patients and they will keep on teaching you, and you get a best practice. So then you can share with the rest of the world. सरताज जी भी थैंक यू कर रहे हैं. सो वी हैव स्पोकन टुडे अबाउट डायबिटीज अक्रॉस साउथ एशिया. वी हैव स्पोकन अबाउट इंसुलिन पेन्स, एंड नाउ वी आर स्पीकिंग इन जनरल अबाउट डायबिटीज केयर. हमने ये भी बात की कि पेशेंट्स का रिएक्शन कैसा होता है इंसुलिन के लिए, एंड वी आर ट्राइंग टू लर्न वेरियस बेस्ट प्रैक्टिसेस. अरे वाह, रश्मि कर्नावत जी, एक वन मोर बेस्ट प्रैक्टिस. इन राजस्थान, starch is always removed from rice, okay, and this starch is used in starching cotton clothes, so that is another use. You can use it to starch your cotton dress, and then it will get ironed very well. Thank you, madam, for this. So that is about sustainable living in olden times, and I'm sure the rules will be same in Nepal as well. One question we had forgotten Rashmi ji ka tha. uh, रश्मि जी कहती हैं, आई हैव हर्ड ऑफ अ पैच वेयर व्हिच वन हैज टू स्टिक ऑन द आर्म. यस, दैट इज करेक्ट. इसको सेंसर बोलते हैं मैडम, SCNSOR, एंड दिस इज फॉर ग्लूकोज मॉनिटरिंग. So there is a small patch. It will cost around, I think, 1,500 or 2,000 rupees, and you apply it on the arm. It doesn't hurt at all. It will remain for 14 days. Every 15 minutes, the glucose will get checked. Glucose check कैसे करेंगे? It is checked by Bluetooth technology. Either your doctor will have the reader, or you can buy the reader yourself from the market, and you can keep on checking your glucose, and it is very helpful actually. So that is something. अगर तो sugars ठीक हैं, you are doing fine, then you may not need to invest in that. But if your glucose is not doing well, you are not doing well, HbA1c is high, high doses of insulin are being used, and still we are not in control. समझ नहीं आ रही what is going wrong, where it's going wrong. Then this Libre or Libre Pro, that is the name, that is useful. In Nepal, Kushalji, are people afraid of glucose checking or of checking their glucose also? Do they say वो भी सुई लगती है, so I don't want to check the glucose?
Yes, the people used to say that it's like a Dhanjatilo kam to what to say for this word,
हाँ,
like they don't feel comfortable with pricking this, and the glucometer doesn't sometimes shows result, but sometimes doesn't show result. It opens sometimes, it sometimes suddenly closes down. That's why I don't want to use the glucometer anymore. I don't want to use
okay,
this in
like
my own home. It only
so.
wastes my time. Some patients only, real patients.
Yeah. So now you can tell them we have good quality glucometers as well. So we can talk to them about buying good glucometers which have got ISO, standardization or labeling, or FDA labeling. So ISO, International Standards Organization, or FDA labeling should be there. एंड रश्मि जी वो जो है मैं नाम रिपीट करता हूँ बिकॉज देयर आर ओनली टू नेम्स इन द मार्केट द सेम कंपनी लिब्रे LIBRE and Libre Pro LIBRE PRO Libre Pro. These are the sensors. Libre Pro, you will buy the sensor and you will buy the machine reader and keep it yourself. For Libre, the reader will be in the hospital and you'll have to go there after 2 weeks. So glucometers की भी जब बात कर रहे हैं and sometimes people don't want to check glucose regularly. In such a case also, the basal insulin is more helpful. जो once a day है, which can be Glargine or Degludec, that will be more helpful क्योंकि उसमें glucose कम check करना पड़ता है. But if you are giving insulin 4 times a day, then the risk of low sugar is also there, so you need to check regularly.
Doctor, can I
If
ask you one question?
sure.
In which condition do we have to use NPH and glargine?
Okay. So ideally, we would want to use Glargine for everybody, ideally, because it is safer, it acts longer, and it causes less hypoglycemia and less variability. But there will be few patients where NPH is better. One is pregnancy, and the other one is patients who are on corticosteroid therapy. Like in COVID, we had to give steroids to many people. Then NPH works twice a day. So, two indications will be pregnancy and uh, patients
With
on
corticosteroid.
steroids. Here, NPH might be more beneficial. Also, it will depend upon cost. So, some people may not be able to afford Glargine, then they can use NPH also in place of that. If your patient is on NPH and is doing well, we should continue. We should not change. But if your patient has poor control or variable control, today the fasting is 100, tomorrow it is 200. Patient
Yeah.
says, I ate the same dal bhat yesterday, I ate the same dal bhat today, but my glucose is changing every day. Then we will tell there is a lot of variability in NPH, so Glargine is better. Also, another thing to remember is Glargine is clear solution, so you just inject like that. But NPH is cloudy, so you have to tell the patient to shake it 10, 20 times. And that is an extra 1 minute that it takes for teaching. अंशु सिंह जी एक और पॉइंट रेज कर रहे हैं अबाउट कुकिंग दैट यू शुड टीच योर पेशेंट्स टू कुक एट लो टेम्परेचर so that more nutrients are preserved. And this is very important in hilly and mountain areas because वहाँ पे जो fuel है that is also at a premium. मतलब ठंड है, बर्फ वाला पानी है, ऊपर से आप firewood लेके आएंगे या गैस लेके आएंगे, it takes more time to heat. So if you are able to cook food at a lower temperature, you don't have to boil everything. Then that will also help in saving energy and it will help in saving nutrients as well. So thank you, Anshu ji. एंड अब मैं रियलाइज कर रहा हूँ कि जब हम सब इकट्ठे मिलते हैं दैट इज अफगानिस्तान पाकिस्तान नेपाल इंडिया देन सो मेनी थिंग्स दैट वी लर्न फ्रॉम ईच अदर सो मेनी थिंग्स कम अप इट्स बिन ग्रेट डॉक्टर कुशल जी हैविंग यू विद अस हमने इतनी सारी बातें की आपसे एंड वी हैव लर्नड सो मेनी थिंग्स अबाउट नेपाल एंड योर वर्क वी हैव Pratik with us backstage. Pratik, could you please show a certificate of appreciation for Madam Kushal? Thank you, madam, for being with us. And anything that you would like to say, everybody from South Asia watching you, listening to you, what message would you like to give to the world?
Firstly, I would like to thank you for giving me this wonderful opportunity. To be honest, this is my first exposure, uh, having this much platform, and As diabetes is increasing day by day, please be concerned about your health and modify your lifestyle as soon as possible, or modify your diets and be healthy, stay safe, stay happy, stay healthy. Thank you.
So happy message आ गया. Stay happy and stay healthy, and take care of yourself. Follow the right diet. कुशल जी, couple of questions coming up for you. स्वप्ना जी, रोहित मसी, सब आपको thank you कर रहे हैं. विनय गुप्ता जी का क्वेश्चन है, फास्टिंग ग्लूकोज इज 130 to 140 even after taking Genomet 50,000 twice a day, I assume. We can ask him to take long lasting insulin once a day, which can be Glargine or Glargine U300 or Degludec. And if you can tell us the weight, we might give you a rough idea dose का भी क्या लेना है. Question Dr. Utsav is asking. Dr. Utsav is a very passionate diabetologist from North Delhi. So he says, have you sometimes demonstrated insulin on yourself, or does the doctor demonstrate on himself or herself how to take insulin so that the patient doesn't feel afraid?
No, I haven't used insulin on myself, but I asked patient to use only 1 unit insulin on themselves uh, for the demonstration only, and to spread away their fear of the insulin use.
Mhm.
I usually make the patient to use the insulin about 1 units only for the demonstration.
So that is also a good idea, and you can demonstrate on yourself. As part of my training, we were asked to inject insulin ourselves. तब तो सुई भी मोटी होती थी डॉक्टर उत्सव, काफी मोटी होती थी 25 साल पहले. तो we had to inject ourselves with a dummy needle, and only then would our professor let us go to the OPD. He said you have no right business treating type 1 diabetes if you don't know how the needle hurts. So of course now the needles don't hurt at all. And Rohit ji पूछ रहे हैं, yeah, insulin is better than OAD because it is safer. It will give better control. And the OAD is if you give too higher dose, that there may be added side effects as well. 76 kg pe something like 15 units Glargine at night is what we would start, Vinay ji. Start with 15 units Glargine at night. And then, Kushal ji, how frequently should the patient monitor himself or herself? We have started 15 units today. So when will you request the patient to come back to you?
I request usually doctors used to request patient to visit again in about 3 to 4 days, with taking their fasting and PP glucose level of whole 3 days,
Hmm.
taking their sugar level twice a day, and after that in around 3 months, and after that one week of observation, then the patient are asked to come visit again for around 3 months, after around 3 months.
So initially maybe more visits, and then after that you don't need too much of visits. And ये भी एक basal insulin की
Yes.
beauty है that you don't have to call very frequently. Dr. Utsav, thanking you for your suggestion that you start 1 or 2 units in the patient in the OPD. And thanks to Sartaj ji, आप सबकी आंखें बहुत सुंदर हैं, इसलिए आपको सब कुछ सुंदर दिखाई देता है. I'd like to thank everybody who has logged in today. कुशल जी को भी थैंक यू कहेंगे. थैंक यू टू आवर इंटरनेशनल गेस्ट फॉर बीइंग विद अस. सबको थैंक यू कहेंगे फॉर बीइंग विद अस. जैसा कि आप जानते हैं, केके मेड टॉक्स का काम है, आवर वर्क इज टू स्प्रेड हेल्थ अवेयरनेस, एंड केके मेड टॉक्स इज ऑन एयर एवरी डे एट 7 a.m. I am 7 p.m. Sorry, Brahmi का time आ गया ना. I forgot my Brahmi today. So it's 7 p.m. and Monday, Thursday are the days that I'm with you. And हमेशा हम एक अलग-अलग टॉपिक लाते हैं. आज का हमारा जो टॉपिक था, इंसुलिन पेन्स, पेशेंट रिएक्शंस, एंड आज के जो हमारे गेस्ट थे, कुशल प्रिया जी, they have brought a breath of fresh air to all of us, and I'm sure we are all energized and more enthusiastic now. एंड जो मैडम ने हमें मैसेज दिया है, स्टे हैप्पी स्टे हेल्दी, वी विल ट्राई टू लिव अप टू दैट. इस सबके साथ आप सबसे इजाजत लेंगे. शुक्रिया, धन्यवाद, मेहरबानी. जय नेपाल, जय हिंद.
Thank
जय
you,
नेपाल.
sir.